So hi guys, welcome. Those who are new in my channel, I welcome you, and those who have been following me, I welcome you back to my YouTube channel. So like I said in my last video, you people, you've been asking me more about management of the low blood pressure, and so I came up with a clear management and more elaborate management of the low blood pressure. So in my previous video, I analyzed what low blood pressure is, but I can just go through it very fast. So low blood pressure is generally the blood pressure reading lower than 90 millimeters of mercury for the top number, and 60 millimeters for the bottom number, that is the diastolic. So how do you manage, for those who are having low blood pressure, how do you manage it? What are you supposed to eat? So I'll be taking you through what you're supposed to eat or what you are supposed to do to manage it at home. So number one, you are not supposed to take alcohol, like you limit the alcohol intake, since alcohol will dehydrate your body, hence lowering the pressure more. Again, keep your body dehydrated by taking a lot of water. You can take 2 to 3 liters of water daily. Again, you eat small meals to help prevent pressure from dropping sharply. So like you don't need to eat a mountain of food at a go. You take slow on whatever you are eating. You eat slowly, small portion at a time. Again, eat more food rich in vitamin B12. Which are things that are rich in vitamin B12? They are things like tomatoes, eggs, fortified cereals, and also beef. Also eat food rich in folate, things like asparagus, liver, and asparagus is the one that is called moshiri, I guess, and liver. Again, you limit high carbohydrates food such as potatoes, bread, rice, and pasta. Instead of eating all these, you can take things like ginger, turmeric, cinnamon, increases blood pressure, and pepper helps in functioning of the kidney. Are we together? So again, carrot juice mixed with little honey is very important when taken on empty stomach. So you can do this early in the morning in an empty stomach. You try and take the carrot juice, mix it with the honey. Rosemary is believed to normalize low blood pressure since it stimulates central nervous system and improves circulation. Add to your food. You can blend it. Mix it with juice, or you can also add little by little into your food and eat it like that. Salt water. Salt helps because of sodium. It increases blood pressure, though don't overdo this. Again, when you're taking salt, make sure that you are recommended by the doctor so that you'll be given the portion that you are supposed to take. Do not take a lot of salt, because we know salt increases blood pressure. Yes, these people we are talking about have low blood pressure, yes, but again, it's not all that healthy. You can also take coffee. Any caffeinated beverage can temporarily increase blood pressure, so drink it in the morning. For those who are used to taking it in any time of the day, kindly mark this. It will be helpful to you when it's taken in the morning. Beetroot juice. Drink it twice daily for a week. It will improve your pressure. Again, go slowly in changing body positions. Okay? Don't just stand like when you are asleep. Don't just wake like someone who is running. Okay? You may be able to reduce dizziness that acquire with low blood pressure that occur on standing positions. Before you wake up in the morning, that's what I was trying to say, before you wake up in the morning, breathe deeply for a few minutes and slowly sit up before standing. So like you just don't wake up the blankets and then you are off to bed. Use that formula. You breathe deeply before you wake up, then it may help. Here I'm dealing with the little management, the management that you can manage for those patients who are having low blood pressure. How can you manage it at home? So in case you are alone and your pressure lowers, assuming you are alone in the house and you feel like your pressure is lowering, what are you supposed to do? So this is what you're supposed to do. You lay down by your back, then you lift your legs up, okay? So like you lay backwards, then you try and lift your legs up straight. So this one will help the blood to flow back to the brain and other organs like heart. Did you get that? So assuming you're in the house alone, you feel like you are unwell, and you know you are a patient with low blood pressure, just lay backwards with lay down with your back, then lift your legs up. This way it will prevent blood flowing towards the leg, and it will help the blood to flow backwards to the vital organs like brain and heart. And this one will be helpful by the time you call for help or you call someone to assist you. Always, this is very important, always contact your doctor to determine what is really causing your blood to be low. In my previous video, I indicated the factors that may cause the blood to be low. And factor number 1, which is very common, it's infections in the body. Or when you are sick, when you are having other diseases, this may really be the cause why the pressure is becoming low, because of the infection in the blood. Another thing which is really common, it's allergy. May it be medical allergy caused by medicine or caused by allergies are caused by different things. There are airborne allergies like there are medicine that there are people who are allergic to medicine, like myself. I'm allergic to sulfur. There are others who are allergic to certain food. There are others who are allergic to different things. So the first thing is to identify what is the cause of the allergy. That way you'll manage your low blood pressure better. Are we together up to there? Did I give you any lesson? So guys, that was our quick lesson. So kindly guys, if you are with me up to there and you've not subscribed, you are new in my channel, I do ask you kindly to subscribe to my channel, and also remember to share. For those who are sharing, you share. There's a share button down here in the YouTube channel. When you scroll towards the right, there is a share button. That's where you do the sharing. That way it will be more helpful to me and to others. So thank you guys. I hope I gave you something to learn too. So that's all I had for today. That was our quick lessons. Until next time, thank you.